start. Today we shall be talking about low back pain. I know in the registration information that we had sent earlier, Dr. Speciosa was supposed to be the one to present, but unfortunately she is not feeling well. And so one of our other surgeons is going to make this presentation on low back pain. Dr. Mwanaidi is an orthopedic surgeon who joined us in January. She forms part of the 3 surgeons that work with us here at Machakos Orthopaedic Clinic. Trained in Eldoret at Moi Teaching and Referral Hospital, and today she'll be presenting on low back pain, our experience with low back pain, the things that we have had as myths, try to bust those myths and try to let everybody go out with the correct information on how to take care of their backs. So, Dr. Mwanaidi, please unmute yourself and then you can continue with the presentation. We'll ask everybody, so if there are any questions, please post them in the chat. Yeah, we'll ask everybody to post their questions in the chat so that at the end of the presentation, we'll present for about 30 to 40 minutes. At the end of it, we're going to go through all the questions and answer them. We know that some people had already sent questions on email. We will also work on those ones and make sure that all the questions have been answered. Our hope is to finish between 10 and 10:15. Dr. Mwanaidi, please continue.
Good morning, everyone. Dr. Mwanaidi, taking over for Dr. Speciosa this week. I'm wishing her a quick recovery. I'll present on low back pain and our experience as the Machakos Orthopaedic Clinic. This is a simplified presentation, hopefully that patients will be able to understand. So we're going to cover an introduction, myths on back pain, and then the symptoms you have when you have back pain, how we test you when you come to see us with back pain, and then we'll go through the causes of back pain and risk factors for back pain, what puts you at risk for back pain, and then how to treat back pain. So low back pain is defined as pain felt along the spine and its adjoining muscles, and sometimes it can be felt up to the legs. And as you can see in this image here, this is our spine, and these are the muscles around, and you can see this area that looks reddened. That's where the pain is, and you can see it's going down, and sometimes it can go up the upper part of your spine. It's a common complaint, and it can be due to mechanical causes where the pain is centered mainly around the muscles and the bones, or it can be due to compression where the nerves coming out of the spinal cord are being compressed. So the spinal cord gets irritated, and when that happens, you have pain going around your waist, pain going to your legs. So what myths have we had on low back pain? There's a myth that back pain is a permanent disability, which is not true. When it's treated, you can go back to almost a normal life. Then there's another myth where people say exercise is bad for back pain, which again is not true. And then some people think that all patients with back pain may need surgery. Again, that is not true. There are specific patients we decide to do surgery on. And then there are those who think that back pain is caused by witchcraft. This is not true. And there are those ones who come to us telling us that they have kidney problems which are causing back pain. This again is not true. Back pain can be a symptom of a urinary tract infection, but it doesn't cause, these urinary tract infections do not cause long-standing back pain that most of our patients come with. So this is just a picture showing how the body is with regards to this one in the middle is the bones of the spine. On the sides, we see the bones of the hip, the pelvis, and then these are the bones going to your thigh. This is the bone going to the thigh bone. So as you can see, this in yellow are the branch, what forms the nerve. They come out from the spinal cord through the bones of the spine, and then they join together to form a big nerve called the sciatic nerve. And this is a muscle that we will talk about later in the presentation. It's also important among the causes of why why some people have back pain. So how do patients show up with back pain? They can have a dull ache in their lower back. Their lower back can be stiff. Then you can have tingling or numbness of your legs. Then you can have tingling or pain in the buttock, and you can have pain in the hip. If you go back to this image, I can show you. So there'll be pain it can be at the middle of the spine, or where the spine joins the pelvis, or here. Now we don't have the muscles showing properly, but this is where your buttock is, so it can be around there. And then it can also be at the hip, which you usually feel around here. So the other symptoms you get is a muscle spasm of the back. An easy way to put it maybe is like a muscle pull of your back. You can get sharp pains. You can have difficulty walking or difficulty standing straight. And some patients show up with weakness of their leg or foot. And also one thing to remember is that back pain may be more on one side of the spine compared to the other. So danger signs, which you should mention to a doctor if you have back pain, is if you've noticed that there's difficulty passing urine. You try go to the toilet to pass urine, it's not coming out, or you are unable to control passing of stool. It just passes out by itself. If you have any fever or chills, if you fell down and injured your back, if you have back pain worse on resting or when you lie down in bed at night, and other danger signs to inform your doctor is if you have throbbing in your abdomen or weakness in one leg, so that when you try to walk, it's causing you to drag your foot or leg, or if you noticed you've had unexplained weight loss. All these are, if you find any of these signs accompanying back pain, you need to tell your doctor so that your doctor does even more tests to find out what exactly is causing problems for you. So what happens when you come to see us when you go see a doctor or when you come to see us at Machakos Orthopaedic Clinic? We will ask you questions. For example, how the pain started, how long you've had the pain, what worsens your symptoms, and other symptoms noted. And we'll also ask you if you have any symptoms when going to the toilet, and we'll ask you about the danger signs that I've previously mentioned, after which a doctor will examine you to determine the extent of the pain and to note where the pain is most severe. After that, we usually decide to do tests, and depending on your symptoms, if you are suspecting an infection or other problems in the body that could be causing your back pain, we send you for blood tests and urine tests. If that is not the issue and it's just back pain, then we'll send you for x-rays. Sometimes if you need to see your bones better, the spine vertebra, we'll send you for a CT scan. And then we can also send you for an MRI scan so that we see your muscles well, your spinal cord, and how your nerves look like. We see if they are being compressed and causing pain. So what causes back pain? Remember the earlier slides had said there are mechanical causes and there are compressional causes. So mechanical is the causes that are affecting the muscles and the bone. So as you can see in this image, muscle strain and sprain is causing pain. Osteoporosis is basically where your bone becomes weak and it's easy for it to break. So that also causes pain. Then there's a fracture of the bones of the spine, a stress fracture that will cause pain. Now, the other thing that can cause pain of your back is arthritis of your spine, which makes it difficult for you to move your body. When you move your body, you feel pain. So that's one of the causes. Then the other causes are compression causes, which basically means either the spinal cord imefinywa, it's being compressed, or your nerve has been compressed. And that now comes here when the disc in between your bones of the spine, the disc acts like a shock absorber. When it goes, it protrudes backwards, where the spinal cord runs in the middle over here, and it presses on the spinal cord, you have pain. Or when the nerve is pressed on, this area around here, you see this image here, this muscle can sometimes, in some patients, press on this nerve, then you have pain. So what are risk factors for back pain? As we grow older, we are at more risk of back pain. If we have poor posture, we don't sit well, we don't stand well, we predispose ourselves to back pain. Obesity and lack of exercise, as you can see in this image, also has an effect on our spine. Pregnancy can also cause back pain, and even after delivery, women get back pain. And then heavy physical work, stroke heavy lifting. And here you can see in this image that this person is lifting a heavy load the wrong way. And then there's stress, and there's sitting for long periods of time. Those put you at risk of back pain. Then scoliosis is basically when your spine has it doesn't stay in the normal way. That's when you get back pain. So also high heels cause back pain. As you can see, this lady has worn, the picture is showing her wearing flat shoes and high heels. And you can see when you're wearing flat shoes, your spine is aligned normally. But when you wear curved shoes, high-heeled shoes, then you have misalignment of your spine. You see, you affect your knees. There's added pressure on the knees and added pressure at your hip, and then it makes you curve your spine a bit more than usual, so you start getting pain. And in addition to knee and hip problems, you also get foot problems because you're increasing pressure on the front part of your foot. So how do we prevent back pain? We prevent back pain by maintaining good posture. We stay active by doing exercises like walking, swimming. We avoid heavy lifting, we avoid stress, and we can do stretching exercises. So you can see here, this is an image showing how a pregnant woman can worsen her back pain. In the first image, it's showing how the baby rests on your pubic bone. And so your knees are locked out, and your back is you push your belly forward. So when you push your belly forward, you curve your back more. And the pregnant woman tends to push her head forward and to make her shoulders rounded. And these all have an effect on the spine. So to correct this, a pregnant woman should pull the back of the head. Instead of pushing forward, she should pull it backward, at least to face the ceiling, the top of the head to face the ceiling. And then she should pull her shoulders back and down, and not pull her chest down, just her shoulders back. And then she should try to position her pelvis a bit more backward and to soften her knees slightly. Where did it disappear? So I go 3 slides back.
3 slides back. Change to more.
It disappear. can't find. Because I can't find a more.
No, it's okay.
Okay. Sorry about that. The network disappeared a bit. So I'll go back to the risk factors for back pain. So there was heavy physical work. When you're stressed, you're at more risk of back pain. When you sit for long periods of time, you're at more risk of back pain. So when your spine also has a deformity called scoliosis, where it curves abnormally, you're at risk for back pain. This image shows the wrong way of lifting things. As you can see, he's bending. So he's putting a lot of strain on his back when he's lifting a heavy object. So this image shows how footwear affects our spine. And here, high heels are the problem. When you wear flat shoes, your spine is aligned normally. But when you wear high heels, you can see that the higher the heel is, the more pressure you put on the front part of your foot. And at the same time, you add pressure on your knees, you add pressure on your hip joints, and then it also causes you to excessively curve your spine. And because now this is not a normal alignment, it predisposes you to back pain. So how do we prevent back pain? So we should maintain good posture. We should stay active and do exercise, low impact exercises like walking, swimming, to ensure we control our weight. We should avoid heavy lifting of objects and especially bending when lifting. We should avoid stress. We should do a lot of stretching exercises to relax the muscles of our back. This image just shows the problems when you're pregnant, how back pain comes about. And this is what the posture most pregnant women take. They walk with their back curved so much and their head leaning forward. And this now, This now causes a misalignment of the spine. To correct that, you should lean your head backward a bit so that you pull your head to face the ceiling. And then instead of, you pull your shoulders back and down, and you straighten your back a bit and you soften your knees slightly so as to decrease strain on the back when you're a pregnant woman. Other things you should do is to avoid smoking, to eat a healthy diet, again, to prevent obesity, to stay hydrated by taking a lot of fluids, to avoid high heels. And you see now here, this image shows how you predispose yourself to back pain. Image 1, you see this person is seated, the seat is a straight seat, and then he's bending forward. So this is wrong because it causes a lot of back pain. But as you can see in this image, the lady is seated straight and the seat is a bit curved around the lower part of the back. So this is a proper posture to avoid back pain, especially if your job involves sitting for long. In addition to that, you should take frequent breaks and stretch. If you sit for long, if you sit the whole day, you should take frequent short breaks to stand up, stretch, walk around, then come back to sit down. This is showing how to lift. In this image, you see this person has bent to lift a heavy load. So this stresses your spine. The way to avoid stressing your spine is to squat, and then you lift the heavy object. So you lift using your legs instead of lifting using your spine. For treatment, we give painkillers, and the painkillers are 2. If you remember, I had said we ask your symptoms, we try to establish whether the pain is just from the muscles and bones, or if it's combining both the muscle, the bones, and the nerve. So the painkillers we give, we give painkillers that sort out the pain that you have from the muscles, the bones, and then it also sorts out the pain. We give a different painkiller to sort out the pain arising from compression of the nerve. Then there's also a painkiller we give that you can just apply on your skin, and then it sorts out the pain and the muscle pull you're having around the muscles of the spine. And usually when the pain goes down, we want you to start physiotherapy, because painkillers are just short term. Physiotherapy now is what helps you control your back pain in the long term. If the painkillers didn't work, then we schedule you for an ultrasound guided steroid injection. And the steroid injection, basically we mix a steroid with two local anesthetic medications, which slightly costs more than a kawaida painkiller that you're injected with. And what happens is, this is an image showing how you inject in the spine. You see, these are the bones of the spine, and you can see the nerves coming out in between the space of the bones of the spine. And so now this injection is advanced, and we inject that medication where the nerve is irritated. Like you can see, this nerve does not look like these other ones, nice and yellow. This one looks a bit red, which shows it's inflamed and irritated. So we inject that medication there to calm it down a bit so that it stops causing you pain. This other image is just showing, the ultrasound is for us to see the nerve well, so it increases our accuracy. This other ultrasound is showing what we can call an ultrasound guided epidural injection. So you can see it's in the middle, the injection is going to be done in the middle of the back. If it's done slightly on the side of the spine, we call it sacroiliac joint injections. If it's done at the butt, where the buttock is, we call it piriformis injection. And sometimes, if the pain is more on the side of the hip, we do it over there. It's called a trochanteric injection. All these procedures are done at our clinic. Other ways of treatment, we had said after you've controlled the short-term pain, we start you on physiotherapy. We hope our physiotherapist is around to give us some more information. And basically, remember, we had said the pain comes about because your muscles are irritated, your muscles have weakened because of poor posture. So now what happens is, we put you on either stretching exercises to relax the muscles that were irritated, or we put you on strengthening exercises to strengthen the muscles that had become weak due to. So we assess you, we look at your x-ray. We usually, remember we talked about back pain having two components. It can be mechanical, arising from the muscles or the bones, and then it can be due to compression of the nerve. So we give you painkillers depending on your symptoms. If it's just from the muscles and the bones, we can give you painkillers that you can take orally or swallow. And we also give you painkillers that you can apply. So it works in two ways to control pain. If you had pain because of muscle pain and nerve pain, then we end up giving you two painkillers. One to sort out the muscle pain, the other to sort out the nerve pain. And then once the pain has come down, we start you on physiotherapy. The painkillers are just for short-term control of pain. The physiotherapy now controls pain in the long term. If painkillers didn't work, then we have a second step that we do. We do ultrasound-guided steroid injections. And basically what this is, it's because your nerve is irritated and it needs to be calmed down. So we mix a steroid injection with two local anesthetics. Those are anesthetic medications that just work where we've injected. This image is just showing how we do. This is an image showing your spine. This appears the muscles of the spine, this part in blue. Then these are the bones of the spine. You can see them. And then in between the bones, see these spaces, these are the nerves coming out, spinal cord. This one's in yellow. So these ones that are nicely yellow, you can see these are happy. And then this one that is red, that one is a nerve that is irritated because of pain. So you see this injection, we advance this injection as we look to see where exactly to inject using an ultrasound. And then we get to the nerve that is irritated and we push in medication over there, which should help things quiet down for at least 2 weeks. And once it's quieted down enough, we start you on physiotherapy. So I'd shown you the type of injections we do. There was the epidural and caudal, then sacroiliac joint injections, piriformis and trochanteric. Let me just show you where we inject those in a while. This is someone lying down, photos from the internet, someone lying down, and the doctor is using an ultrasound to locate where exactly the pain is, where the nerve that is irritated is. So if the most pain is in the middle of your back, that's when we give you an epidural, which we inject along the middle of the back, an epidural or caudal injection. If the pain is slightly to the side, on either side of your spine, that's the sacroiliac joint region. Remember where the pelvic or hip bones join the spine bones. We inject over there, just slightly to the side, still on the back. And then if the pain is not there, if the pain is on your buttock, this is now what we call a piriformis injection. So you can see here, this is the ultrasound to trace where the nerve is. And then once we find where the nerve is using ultrasound, we inject the medication. And the last injection that we do is a trochanteric injection. That is if the pain is most around your hip, around here. So we inject over there to calm things down so that you can at least have some relief and go back to living life normally. So after the pain has been managed, and back pain never disappears completely, but our goal is to reduce it to a minimum so that you can go back to life normally. And then now you control it in the long term with physiotherapy. Physiotherapy includes stretching exercises that strengthen one's core, heat massage therapy, and TENS. So for stretching exercises, remember I'd said sometimes your nerves have like a muscle, your muscles can have like a spasm or muscle pull. So stretching exercises help to relax them slowly but surely. Then sometimes because of poor posture, sitting, standing, the muscles around your back and around your abdomen become weak. And that contributes to more poor posture, which contributes to more back pain. So it's like a vicious cycle. So how physiotherapy corrects this is by making you do exercises that strengthen those muscles. And now when you strengthen those muscles, then you're able to stand in the proper posture. And when you stand in the proper posture, your body stops complaining as much, so your pain goes down. Other things that our physiotherapists can do is heat massage therapy, where they massage you with something warm slowly. And then they can also try to stimulate your nerves. That is what TENS is called. It means stimulating your nerves. So yoga and Pilates are just exercises again, which help with correcting your posture, which help you be a bit fitter. So it helps to decrease back pain. Surgery is usually done as a last resort, where we've tried everything and it cannot be helped. And it's also done in those patients who start having problems with, It's usually done in those patients who either we've tried everything, it's not working. And if not for that, the other patients who come in and complain that when they go to the toilet, they're having problems. Either they have problems passing urine, where your bladder is full, but you are not able to pass urine. And the other issue is, if you find yourself passing stool, you cannot control so that it does not come out. It just comes out itself without you being able to control. Then that warrants surgery. So I think I've come to the end of my presentation. I think I'll hand over to Dr. Guku to moderate questions.
Thank you, Dr. Mwanaidi. I think we'll start with that. That was actually an excellent presentation. Thank you for taking us through the basics until where we can now say we are getting a bit into medical stuff. We appreciate. And so to make it fair, I'm going to start with the questions that were sent the oldest. And the one that was sent the oldest were messages that were sent on email. There is Ambrose Mwaniki who asks, when patients go to surgery, sometimes they're given an injection to the back for giving them anesthesia, what we call a spinal anesthesia. Does that cause back pain? Or maybe I just read all these three questions and then you can just answer them. So one is, does that injection to the back cause back pain? Secondly, how exactly does this pregnancy relate to back pain? We saw the slide that you had presented, and maybe as you're answering it, you can go back to that slide to expound more. And then he finally is asking pain management modalities in low back pain, which I think you have essentially gone through. So maybe you can answer his first two questions, Dr. Mwanaidi.
Okay. For whether spinal anesthesia causes back pain, it's not that common. What patients mostly complain about might be a headache, which we usually tell them we either give them medications with caffeine or we tell them to take coffee. But back pain, I've not come across it. Maybe Dr. Nguku has. I don't think it's that much.
No, people will talk about it, but it is not as a cause of the spinal anesthesia. Some people may have had back pain before surgery. Some people may have had surgery because of another cause. Maybe when we answer the next question, we can see the relation that we have talked about, pregnancy. I don't know if you mind going back to the slide on pregnancy.
Okay, so for pregnancy, remember there's the way before pregnancy, the way women walk around, the way our bodies are made. If you did physics, there was that thing called center of gravity. Remember, let's see, how do you call it? How your body manages to stay stable while you walk.
Yes, yes.
But now when you're pregnant, remember you get an additional 9 to 10 kilos and it's going towards the front of your body. And so the way we were created, it's that when we gain this extra weight, it will make us a bit unstable. Because you see, the body, 9 to 11 kilograms on the front of your body will tend to push you forward instead of backward because you're not balancing so well. So in a way to try and balance that, you try to correct it as you're pregnant and walking. That's why you see pregnant women start pushing their back forward to curve their spine a bit more. But at the same time, they are struggling because their head is being pulled forward because the body, the front is more heavy compared to the back. So because of that, what do you call it, that extra weight and your body not being used to it, you start getting, because when you have that extra weight, it causes your spine not to be aligned the way it should be. Like it's not in the normal position that it should be. So it starts curving forward because it's being pulled forward. And that now gives you, what do you call it? It gives you problems. You're straining your spine. Then in addition to that, that's one cause is the way the spine is positioned. The other thing is, as you're getting pregnant, as your pelvis is increasing its size to accommodate this baby, there are structures around your pelvis that start to become a bit relaxed to increase capacity to carry the baby. So as they start relaxing and expanding, you get a bit of that pain. So that's why you see it's important. You see, like here in this image for the pregnant woman, see that this 9 to 10 kilos is pulling her forward. So you see the head is being pushed forward. So in an attempt to stabilize herself, she starts to push her back forward, which now makes the body try to lean a bit backward. So you see the back now becomes like you've pushed it excessively in front, so it becomes extremely curved. All this now cause problems with how your spine, the normal position of your spine, the way it's supposed to be. And you can see even here, the knees, she's like curving them backwards. But here, in this period, in this picture, showing us how you're supposed to stand when you're pregnant, you try pushing your belly a bit up and your head a bit up so that it straightens your spine instead of it curving forward. The way this one is excessively curved forward, you've straightened it a bit. Also your knees, you've straightened them a bit so that they don't curve as much as these ones. So you straighten your knees, you straighten your hips, you straighten your spine. So you and you lift your head a bit to the top of your head to face the ceiling. So that corrects your alignment. Then you have less back pain when you're pregnant. Now the other thing about back pain after delivering, remember there was that expansion that went on around your pelvis area. So you have to give time for things to go back to normal. Then hopefully your pain goes down.
Thank you. In the last, I think during the last presentation, when we were talking about arthritis, we introduced an idea of a hormone called relaxin, which is what causes all this excessive bending and back issues. And that hormone has been associated with excessive movement in the back, excessive movement in other joints. And after pregnancy, back pain tends to result because of that excessive movement. Now, back to the issue of the injection that is given to the back. So some of the women that we have seen coming to the clinic complaining about back pain after that injection to the back, it was not the injection. It was the back pain that had started because of pregnancy. And so the injection that was given to the back was actually not related at all to the back pain. Another question that came in through email was from Vicky Nyaga, who asked, tailbone pain, what can help in relieving that? Because some people who come tailbone pain, which in our medical terms we call coccygeal pain, what can help in relieving that? Because it makes it difficult for patients. You need to find an interesting sitting style so that you don't cause pain. What is your opinion on that? I can comment after you're done.
I didn't come across that. Maybe
It's okay. I can give it a comment. Unfortunately, tailbone pain takes a very, 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 very long time to take care of. Unfortunately, that doesn't sound nice coming from a doctor. But the main forms of treatment is we'll give painkillers. Some people will talk about giving a ring to sit on. Some people will talk about things to apply that don't also irritate the buttock. The reality is this. It is a pain that is difficult to take care of. Eventually it goes away. We hardly ever recommend surgery because surgery tends to have very many complications. So the best thing is just try and take off pressure from there and be very patient. It will eventually go away, but it needs a lot of patience. A question from Teresia Wawero, now on the charts. She asked, how many injections do you give? Because you talked about giving an injection to the back for pain. I know there are centers where they will talk about, we'll give you one injection every month for the next 3 months. Some people will say, we'll only give you one. Dr. Mwanaidi, how many injections do you give?
it depends on where the injection was done. If it's epidural, that is in the middle of your back, I know most centers will say they only do it twice a year, so after 6 months. And then if it's the sacroiliac joint injections and the others, I think those can be done every 3 months.
And the important thing to remember is that it depends on the pain, because if we give one injection and somebody has very good relief, then there is really no reason them coming back after the 3 months. But if there is pain, even after we have done the injection and we have been on physiotherapy, then yes, we will repeat the injection. So the repetition is based on the response to the first injection. Okay. Somebody else asks, calcium tablets, how are they used in low back pain?
Remember I had said one of the causes of back pain was osteoporosis. Remember, let me just go to that slide. This slide, where I had said there are mechanical causes of back pain. So that's muscle causes, bone causes. So if you have weak osteoporosis, basically means weak bones. If you have weak bones, that's one of the things we give to treat. But there's another medication for it, there's not necessarily calcium tablets. There's a specific medication to treat weak bones. Yeah.
Okay, thank you. And while we are still on that slide, somebody else is asking, this back pain, does it cause a tingling sensation in the hands or pins and needles in the hands?
Sorry, I didn't hear the question.
Somebody else is asking, the back pain, the back pain that we are talking about, is it associated with or does it cause a tingling sensation in the hands?
Oh, now when it's a tingling sensation in the hands, then that is more likely to be due to neck pain up here. So it's upper back pain. No, it's more of the neck, because the nerves that come from the vertebrae in the neck have been compressed. So that's when now you have back pain, and that's when you have tingling in the hands. But other diseases can cause tingling. For example, diabetes. So you also have to make sure you're tested for diabetes if you have tingling in your feet or in your hands.
Okay. There is a request for you to expound on how stress causes back pain.
Let me see. When you're stressed, you don't think so much about self-care. So you won't be very, very keen on things like posture. And then also some people stress eat, so it's easy for you to get to obesity, which again causes back pain, things like that.
Okay. Is shoulder pain related to back pain? And also, this back pain, is it associated with a burning pain at the front of the legs?
Shoulder pain can be associated with if you have shoulder pain, we also have to make sure your neck, the bones in the spine on the side or where your neck is, you have to make sure that they're fine. Because sometimes the nerves, it comes again to the same thing about tingling in the hands. You can have shoulder pain. But apart from that, there can also be arthritis in your shoulder independent of back pain. Now, the other issue was the second question. What do you call it? The burning pain.
Burning pain at the front of the leg. Maybe we can define where we expect the burning pain. Yeah.
It goes again back to the causes of back pain. Remember I talked about mechanical, that's the pain arising from the muscle and the bone. So if you get a burning pain, that's also one of the signs of nerve pain. Signs of nerve pain include burning pain. When your nerve pain happens when your nerve is compressed. So signs of nerve pain include burning pain going to either your hands or your limbs, and then numbness, guinaganda, and then also tingling in the hands and feet. Those are signs of nerve pain. So burning pain is also, it can be associated with back pain. But then remember, nerve pain also happens when you have diabetes. So that's again one of the things we have to confirm you don't have.
Okay, so before I go to the other questions, let me make some comments, or rather, let me read some comments that have been made, some of them privately to me, before I forget them. So there was a comment from one of the physiotherapists also reminding us about the issue of shoes. We commented about high heels and talked about the trouble they give, and the current recommendation on the size of heels that we should wear is what we call a medium heel shoe, which is approximately an inch. the size of about an inch. So a lot of men will be wearing shoes that are within the correct zone, but women, we've been having issues with them wanting to wear way higher or way lower shoes. So we recommend that you consider wearing shoes of about an inch. They don't tend to affect the back. Then secondly, on physiotherapy, it is important to note that for a patient to have good outcomes, there needs to be collaboration between the doctors. Actually, let me not say the doctors, all the healthcare workers that are dealing with that person. Because if a patient comes to see me or see Dr. Mwanaidi and tell us one story, and then I send you to another doctor out there, and there is no communication between us, then it becomes difficult to treat you, because I'll be doing some things in isolation and the other doctor is doing some other things in isolation. And so when physiotherapists work with the doctors closely and they communicate, it makes the outcomes of the patients way better. So one of the comments that Dr. Catherine has made, and you've seen it there on the posts, is that physiotherapists and doctors need to work closely so that you can end up with good outcomes. Because we know back pain is something that we're going to treat for long. And we don't want patients or people just moving from one doctor to another because they're dissatisfied. And the reason for the dissatisfaction is mainly because nobody talked to them. Nobody explained to them what is going on. Nobody explained to them, now that you're going for physio, this is the expected outcome over this duration of time. And after that time, you need to go back to your doctor and he needs to do ABCD. So us working together makes a big difference. Like, for example, our physios, they're here just about every day of the week and the doctors are floating around. So if a patient is around and needs to be seen, it is not very difficult for the physio to just call the doctor into the room and say, this patient, you said they have this sort of back pain, but then in our assessment, we have found they have this kind of back pain. How should we proceed? And a discussion can be held there and the way forward made. And then there was a comment from also one of the physiotherapists saying that even when they're treating back pain, there are so many different modalities. And I will not go into the names of all these because our presentation is not targeted at the medical people. It's currently targeted at our patients. And so our patients need to know that just because Mrs. So-and-so alichoma mgongo and it worked for her, does not mean that even you, if you have back pain, your treatment ni kuchoma mgongo. The various physiotherapy modalities are directed at the cause of your back pain. And so when somebody comes and says, niko na uchungu kwa mgongo, or I have pain in my back, pain in your back for person A is not the same cause, is not coming from the same cause as pain in the back for person B. And so when a doctor sees you, he will assess and say, or she will assess and say, your pain in the back is coming from this cause. And so because it's coming from this cause, this is a kind of treatment that you need. And when you go to physio, physio will also tailor your treatment to specifically that cause. And that's how we can end up with reasonably good outcomes. Another question from Rahab. Let's see. She says, my back pain occurs mostly when I stand for long. When I sleep at night, then stand, the pain is intense. I then have difficulty in bending. So, Dr. Mwanaidi, the question to you is this one of the causes to worry?
Sorry, when was the back pain worse? You were breaking off.
Oh, sorry, I said, she says that she has back pain for long. Mm-hmm. Let me get that message again. Yeah, when she stands for long. And when she sleeps at night, and then when she stands, the pain is intense. She has difficulty in bending. Is this one of the causes to worry?
One of the...
Cause should she be worried because of this? She bends, there is pain. When she sleeps at night, there is pain. When she stands for long, there is pain. Should she be worried?
I think she should just come in, we assess her.
Okay.
Yeah, it's better we assess. Then now from there, we'll be able to advise.
Okay. Let's see. Yeah, there's some comments about physiotherapy and how it should be specific. Somebody is still saying they're not quite sure how this stress is causing back pain. So the general thing that happens with stress is this. Some of you may have gone for an X-ray of a back and you read the report after that, and the report said muscle spasm. And muscle spasm tends to be muscles that are tensing up because there is a cause of pain somewhere. Whenever we are stressed in the head, I'm not talking about now in muscles, whenever we are stressed in the head, we will do things around us that are not healthy. Dr. Mwanaidi talked about excessive eating for some people. Some people will go and sit down and decide, I'm going to watch only TV. So we'll do a lot of unhealthy things around us. All these unhealthy things are the various factors that we talked about of low back pain. Things like obesity coming up, things like muscles tensing up, and because they tense up, we end up sitting in abnormal positions that don't allow our back to be comfortable, avoiding exercises. All these things tend to lead to back pain. So it is not a direct cause, kama niligongwa na chuma kwa mgongo. No. It's one of those that is an indirect cause of back pain. Somebody else is asking here, is there physiotherapy at our clinic and what is the cost? I will, actually, let me just post right now. I am going to post the number for the clinic, and then you can just call the clinic any working hour and they can answer that question. Yes, there's physiotherapy in the clinic. Yes, it is there Monday to Friday. The costs, the timings, I will ask you to just call the number 0733398390. That's the clinic number, and they can answer all your questions pertaining to ni saa ngapi, ni pesa ngapi, all that.
And don't forget, we have online physiotherapy for those who cannot travel all the way back here.
Oh yes. One thing that we decided to do because of COVID, we know that not everybody wants to put themselves in a matatu, or not everybody can afford transport. I hear some of the places have even doubled the amount of fare. So we are doing a lot of online things, and one of them is this Zoom meeting that we are talking about, that things that would have previously gone into a meeting room and discussed about, we are now discussing online. And so to also make it easier for our patients, we are doing some online things like online physiotherapy and online consultations. And so when somebody has had physio physically here for a while, they're given an exercise program to do at home, and supervision is done through a video consultation. And when you call the number, they can give you the instructions about how to go about it. Obviously, because you're not coming here physically, it is much cheaper. And we're also doing the same with other consultations for the doctors, that when I have seen you once, twice, and the third time I don't necessarily have to see you physically, we also do a phone consultation, which also makes it much cheaper, because once you remove the cost of transport and the consultation goes down, it makes it easier to be seen and cheaper to be seen. How can back pain after spinal injection be managed? I think, Ernest, we had just discussed that, and we said the injection, the spinal injection, does not cause back pain. The cause that the pain that we know comes directly from that spinal injection is a headache, that Dr. Mwanaidi talked about. And so there must have been another cause of a back pain before the injection. So the injection per se did not cause that. I don't know if Dr. Mwanaidi, there's something that I have missed out that you'd want to comment or clarify?
I think we've covered everything.
We will allow, let's see, another 4 minutes so that you can be able to answer any other questions that may be burning. Oh, I see here, it says he's asking about spinal infection and not spinal injection.
Oh, okay.
Okay, so Dr. Mwanaidi, you can talk about that. I know one of the commonest spinal infections is TB of the spine. Any comment about that?
What do you call so infection after a spinal injection?
No. Back pain after a spinal infection. And one of the commonest spinal infections we know about is TB of the spine. When patients get back pain because of that, what intervention could we give?
So remember I had said we ask the patients what symptoms they have, and we try to elicit other symptoms apart from the back pain. So if we notice, like, remember among the danger signs I talked about fever or chills, that is one of the things that alert us to the possibility of a spinal infection. So when we think of a spinal infection, we have to do more tests for it. So a patient we suspect to have spinal infection, in addition to how we examine, there are things we note out, we look out for. The spinal infections are different types. There's the one that comes after a short time, which we call acute, which can be due to bacteria. Then there are the ones that have been there for a longer time, which can come about due to tuberculosis. So dependent on what we find when we ask you questions and when we examine you, it also directs how we do the tests. And when we do the tests, if we're suspecting an infection or any other problem compared to the normal back pain, then we will send you for blood tests, and we do 2 tests that show us whether there's infection. We do one test called complete blood count, which shows us the level of the different blood cells in your blood. For example, red blood cells, white blood cells, and the platelets. So we check that. Then there's another test that we do, which shows presence of infection in the body. And now when we notice any abnormal results in that, we become a bit aggressive in how we send you for tests. So the other thing that, The other thing that happens when you want to diagnose an infection of the spine, some infections will show signs on X-rays. And if not on the X-ray, it will show signs on the CT scans. And if not that, it will show sign on an MRI scan. And once we discover what exactly the infection is, sometimes there can be an infection of the bone of the spine called the vertebra. If not that, there can be infection of the disc, the shock absorber in between the spine. Let me just look for an image. So the infection can affect different parts. It can affect this bone. This is the bone of the spine we call vertebra. Then these pink or purple things you see, those are discs. Sometimes it can affect the disc. If not that, sometimes the infection can become really bad. It causes collection of pus, either here at the front or here at the, well, usually most likely it's around here somewhere at the front, which if we notice, there's also ways we treat that. And then sometimes the infections can cause weakness of the bone of the spine, like in TB, which can cause this bone to, to break or decrease in size. Or sometimes infection can eat away the bone. So when we tell you we'll see signs on X-ray, that's what we'll see. We'll see maybe the bone has been destroyed, it's been eaten up by the infection. And now, dependent on what infection it is, if it's bacterial, we can take you, if there's like pus that has collected somewhere, we can take you to theater, we drain the pus, we wash out the place. If it's TB of the spine, which usually tends to eat up the bone of the spine, we be dependent on how bad it is. If it's not so bad, we put you on anti-TBs, the TB medication. If it's really bad, we take you to theater, and we can, if it's really bad, causing problems to your spinal cord, we take you to theater and we stabilize your spine after we drain whatever pus was there. So the mode of treatment depends on how bad your symptoms were. If it's mild, we give you medication. If it's bad with collection of pus, that takes you to theater. If your spinal bones are a bit destroyed, causing instability in your spine, which could compromise your spinal cord and probably put you at risk of paralysis, again, that is one of the reasons why we take you to theater. I don't know if Dr. Nguku has anything to add.
No. I think I'm happy with that. I will not add any more. Two questions or two comments. What about corsets? The use of corsets in the back. Any comments?
So the use of corsets in the back, sometimes that happens like when you sustain a fracture of this vertebra of your bones, dependent on how we look at it. If it looks one that we can avoid going to theater, then we give you the corset. And the corset is it's a hard one to support your back and to make you avoid getting a posture that can cause the bone to move and cause problems. Yeah, so we tend to give that in patients who have fractures, probably due to maybe they were involved in an accident or they fell, or if they have fractures due to weakening of the bones in your body because of osteoporosis, we can see how to give you a corset, which you wear for a few weeks. Then once the pain has gone down, then we feel like you're a bit more stable, we tell you to stop wearing it.
Yeah, so the general thing we try to advise our patients is when it comes to the use of corset, it is only used in the acute phase. And by acute is what Dr. Mwanaidi is talking about, a few weeks. We try to avoid going beyond a month, because beyond a month, most of the initial pain is gone, and now it starts causing a weakness of the muscles. And when we cause a weakness of the muscles, we make the work of the physiotherapists much more difficult. So kwa sababu hatutaki kukosana and we make each other's work difficult, we use the corset for only the acute phase, and then after that, we now use the other modalities of pain control, of physiotherapy, home exercises, muscle strengthening, and the like. Well, thank you everyone for joining us today. It is 5 minutes after 10. I know we have an allowance of going up till 10:15, but nowadays there's something called Zoom fatigue, or I don't know what other name we are giving to it. So we don't want to keep you all on Zoom the whole morning. People need to go to their families. But I will make a few comments, then after that we can close. I had written a comment earlier to the physiotherapists, alerting them that we'll be having a Zoom session and that I will give I'll give the dates by the end of the session. So Saturday, 5th September, Dr. Catherine will be talking on the same topic of back pain. And now you can use Latin words and other difficult languages to communicate to each other, words that if we had put here, only half of us would understand what we are talking about. About a week to the time, we are going to send out the Zoom link to the physiotherapists so that they can plan to join that. We will still continue with our monthly talks with our patients. And so within another 4 weeks, we'll communicate the date on WhatsApp to our patients. We'll send out another Zoom link on the topic for next month. I yet don't know, the person who's organizing has not yet alerted me about the topic for next month, but with 1 to 2 weeks before, the message will have been sent out to the team. Once again, it will be a Saturday morning so that people are not having to run from work to come and listen to us. I have posted there another comment saying that if anybody still has any questions after this session is over, you don't have to feel trapped that now you don't know how it can be answered. Please send us a WhatsApp on our number. One of our doctors will be able to see the question and answer it. We will try to do it within working hours. So if you see us not answering the question at midnight or on Sunday afternoon, please understand what wameenda kupumzika, but at the earliest opportunity, we are going to answer the question. Hilda is asking a question about whether traction helps in any way. Traction is a method that we used to use before for acute back pain. We don't entirely recommend it now. What we more recommend on is rest. And the main reason why traction used to work was because it would force a person to rest in bed. So if we have another way of forcing you to rest in bed, then we do. There are people who still practice traction. It does not do harm. And so I will not demonize it, because what we are doing is trying to enforce resting. So thank you. Thank you, everyone. Dr. Wambua is saying that she would love patients to be present for the low back pain presentation. So we will also alert them and we'll make sure that the two of them don't clash, that your presentation and our next presentation don't clash. We will make sure that they don't. Thank you, everybody, for joining us, and we wish you a very good and blessed afternoon. Oh, actually, morning and afternoon.
Thank you.